Hello, welcome back to MetaMe. Today we are joined by Dr. Kommana.
Hey, how are you? Thanks for having me.
No problem. So what is your doctorate type?
So I'm an MD.
Okay. And what's the specific specialty you work in?
So I'm an ophthalmologist.
Nice. And where do you work?
So I work in a private practice in Southern Colorado.
Nice. So what education was required for you to become an ophthalmologist?
Okay, so I went to high school and then in college I did 4 years of college and I did a bachelor's of uh, neuroscience, bachelor's degree in neuroscience, and then I went to med school in New Jersey, um, and then I did intern year, like 1 year of internship at Temple University, and then I did 3 years of ophthalmology at Temple as well, and then I did 1 year of cornea fellowship at Cornell in Manhattan.
Wow, that sounds like a lot of moving.
It's a lot, yeah. It was a long journey, but I'm on the other end, so it's all worth
So what was your motivation to choose ophthalmology?
Well, I was born in a family of doctors. Like my grandpa was a doctor and my mom is a doctor. Ophthalmology specifically, though, I have no ophthalmologist in my family. But first year of medical school, I was introduced to eye screenings, like local community eye screenings, and that was the closest I've got, like, to patient interaction as a first year, because first year is all about books. So I thought that was the coolest thing. So I'd go like every couple of weeks to the local community with lots of different tools and technology to like look at the back of the eye, like fundus, IOP checks, like all these different tools. So I was really involved and had hands-on experience. And since then, my love for ophthalmology continued to grow. So,
Nice. That sounds interesting. Is that like common? Do most like people in med school find out what they want to do at that point?
no, absolutely not. I think I was early. I had definitely had an interest in ophthalmology starting my first year, and I had really good mentors, like two really good mentors. But I had my eyes open to like other fields too as I was going. And I think by third year, I was like, okay, I think this is what I want to do.
Okay.
So
Yeah. So you might have already went over this, but what was the required residency time to become an ophthalmologist?
So 4 years. So you have to do 1 year of general internal medicine or a transition year, and then 3 years of ophthalmology, and then fellowship depending on what you do within
Hmm.
ophthalmology. Yeah.
So, walk us through a typical day of being an ophthalmologist from start to finish.
Yeah, so I'm in private practice, so it depends on if you're in like an academic setting versus private practice. So my days usually start around 8, and I'm in clinic 4 days a week, and surgery usually 1 day a week. So 8 to 5 is my clinic schedule. So we have morning patients, afternoon patients, a pretty busy schedule. We see a decent amount of patients. So this is like a very fast paced kind of setting.
Mhm.
And then my surgical days start around 7 p.m. Oh, 7 a.m. Sorry. And then they can go, it could be a half day or a full day, depending on how many cases I have.
Wow. Yeah. Does that get like very tiring usually, or do you like are you fine with your hours?
It can. So I have control over my clinic schedule, right? So if I want to see more patients, I want to be busier, I can add more. But if like, no, I like this pace, I can keep it at bay. In surgery, you have to work up to it. Like, initially you're not going to be doing as many cases because you gotta, you gotta develop the stamina. But now I've been in practice for 2 years, so I've built it up. And I feel like, I only book what I can handle.
Hmm.
So.
So, what would you say some pros would be of your job?
It's perfect. No, I'm just kidding. But no, so like it's a good mix of surgery and clinic, which you'll notice that some specialties don't have that. And I like that mix because it gives me a break from one or the other. It's mostly outpatient, which I wanted. I really didn't like the hubbub of the hospital. And that's, you'll learn as you go through schooling. It's quick surgeries too. Like cataract surgeries are pretty on the quicker side, and they're really rewarding to the patients and the doctor too, because you could really change someone's life through just this procedure. So, and I think the other thing I really like is the personalities in ophthalmology too. They're pretty chill, like easygoing, smart but easygoing.
Sounds like a lot of good pros, but would you say there's any cons of your job?
Um, I, I guess one of the things is ergonomics. We use microscopes a lot when we're operating and when we're in clinic, so that positioning, you have to be really careful from when you start, or else I've seen a lot of people have neck and back injuries as they get older. So that's definitely a
Mhm,
big thing. And then it's microsurgery, so it's not for everyone, and
mhm,
and that's kind of something you learn on the job. So yeah, those are the only two kind of big things I say.
mm, that's good. So was there a certain experience that you had that changed your mindset in your career, whether for the good or bad?
Um, well, I did go to a mission trip in India as a third year resident, towards like the end of my third year. And I thought it was really eye opening about, because I guess when you train and stuff, you only see the US facilities, you see what's common in the US, but seeing what the world does, because cataracts are a universal problem, right? So,
Mhm,
how, what kind of technology they use, and what the different tools and techniques that they use, and they have to accommodate their situation, right? Whether it's wealth, whether it's the type of technology, whether it's the patient's, income, all that stuff. And it was pretty incredible because you can do the same kind of surgery in so many different ways. So I thought that was really eye opening, and it made me think of things differently when I came back to my job here.
yeah, that's good. I'm sure there's lots of students who want to be an ophthalmologist. So, what kind of person would you recommend this job for? Like, whether it's characteristics wise or skill wise?
Yeah, I definitely have to say you have to be detail oriented, because this is all in a small eyeball. Very detail oriented, very motivated, and you got to be pretty fast. I think this is a quick paced um, field, and I think a love for technology and new toys is a added bonus, because the the field is changing. There's so many more tools and lasers and microscopes that are being introduced into the field. So someone who likes that change and development, I think would be a really good fit for ophthalmology.
Mhm. And this is a question that I should have asked probably earlier in the interview.
Mhm.
But I know a lot of students might not know the difference between an optometrist and an ophthalmologist. Could you please define the difference?
Yeah, no. So as I told you, ophthalmologists have to go to medical school, 4 years of medical school, and then they do 4 years of residency as well as a fellowship. Optometrists, they go to undergrad, and then they go to 4 years, I think, of optometry school, um, and then they can do residency, but it's a little bit shorter. It's like a year or something from ophthalmologists. Um, the biggest thing is that they don't do surgery. They mostly do clinic work. They're more glasses, contacts oriented. Some are more medically oriented, but the ophthalmologists are the ones that do most of the procedures.
Mhm.
So that's kind of like the biggest difference.
Okay, yeah. Thank you for defining that. I'm sure that like cleared some stuff up to someone who might not have known.
Yeah, of course.
Um, so do you have any particular tips for high schoolers in general if they want to possibly go into ophthalmology?
So I think keep an open mind. I really think shadowing is the best way to kind of know what we do. There's a lot on YouTube. You could always Google stuff on YouTube, but I think talking to someone or like being in the setting is the best. So if you have any local ophthalmologists, or someone a friend of a friend, don't hesitate to ask, to see if they can just, you can just shadow them for like half a day or full day. I know that's what I did when I was early on. Different specialties, like I did all kinds of specialties, and that's how it really helped me narrow it down.
Mhm. Yeah. Thank you so much for joining the podcast today. That's all the questions I have for you.
For sure. Thank you so much for having me.
Thank you.